All right, guys, I'm pretty sure this is working now. I owe you guys a lecture for the anti-inflammatory drugs since I was choking the other day in class. So this is going to be just the lecture that we missed on last Friday. So hopefully you guys can use this when you're on your 2-week break. And that way you know I didn't die. So let me make sure this works for the screen for you. Hang on just a second. Haven't used Zoom in a while. Okay, hopefully this worked. So this is going to go over syllabus objectives. You read those on your own. We're actually going to start with some miscellaneous drugs. And you guys have probably seen these in practice if you're working in practice, or at least heard of them. Gabapentin's become more popular. It actually started as an anticonvulsant, still used as an anticonvulsant, but it also helps with pain. Usually they'll use it for nerve pain, so osteoarthritis. I've actually met people that have had, I think I had one coworker that had lupus and I was actually on it because it helped with her nerve pain. I've met people that have had cancer that have been on it and say that it helps really well, but we do use it in animals for pain. It's become kind of a go-to for post-op pain, as well as, again, nerve pain. And it's kind of a good drug to use if they don't want to use an anti-inflammatory or maybe not tramadol. So if they decide, because I've actually worked with some vets that don't believe tramadol works all that great. So gabapentin has become kind of a go-to. They also use it for behavioral issues in cats. So I've actually had patients come in, had behavioral problems where the cat's maybe urinating outside the box, and they've used gabapentin as kind of a way to calm them down, kind of reduce the anxiety. And that way, with some other training and just figuring out what the trigger is for the cat, it does help when they're doing some soiling outside the litter box. Not quite understood how the mechanism of action works, but the thought is that it almost blocks the pain sensors in the brain. And then it's telling the body it's not in pain anymore. Usually comes in capsule form. I know there's a liquid form, which is like a cherry flavor. You can get the 100 milligram capsules up to 300 milligram capsules. Next drug is methocarbamol or Robaxin. This is a drug of choice for muscle relaxation. So cats, dogs, horses, dog comes in, maybe jumped off the bed, hurt themselves, or they've got neck pain. This is a good medication to relax them. If you've never had to take it yourself, that's awesome. I've taken it for just if I pulled a muscle or something. It's amazing, but it does tend to make most humans, I would say, as well as most animals, pretty sleepy. So it's something that we might tell the owner to give at nighttime, or at least to let them know that there's possibility animal might be kind of sleepy at home. So it might make him kind of sedated. So things like IVDD and dachshunds, any kind of like disc rupture, any kind of neck pain, back pain, it's a great drug. And then again, sedation for side effects, sometimes salivation, sometimes ataxia, just because they're so sleepy, they just they start walking like they're drunk. And then I haven't seen it very often, but definitely emesis is a side effect. Antihistamines. So these are going to be drugs that block histamines, things that, let's say a patient has something where histamines are getting released, and that could be their body. It could be if they have like a mast cell tumor and doing the surgery to remove the mast cell tumor is going to release histamines. We can put them on a medication that will actually block those histamines. So think of things like Benadryl, so diphenhydramine. So histamine 1 is inflammatory response to allergens. H1 blockers are going to help control signs of allergic reactions. So diphenhydramine is a great drug. Not the best for things like allergies, though I have talked to some owners that feel like it does work really well for their patients, or their pets, I'm sorry. Chlorpheniramine, things like Dramamine are other good antihistamines. Hydroxyzine, I feel like for a while there when I first started in practice, was used as allergy medicine. It was just to kind of help them not be as itchy. Definitely some better drugs out there for that now. It definitely causes sedation. So these particular drugs wouldn't necessarily be the best for allergy, though some animals do well on them. It's just that they need repeated doses throughout the day. And most of the Benadryl comes in like the 25 milligram or the 12.5 milligram. So it's just a matter of dosing properly. It is good for like an allergic reaction to something. So they get stung by a bee, they have a vaccine reaction, we are going to go for the diphenhydramine. It's just not a great maintenance drug for allergies, at least in my experience. That's not to say it won't work for some patients, but there's just better drugs nowadays like Apoquel and Cytopoint that work better for allergies. Histamine 2 increases gastric acid secretion. So there's going to be medications that we'll use to help treat some stomach problems. So if they just have too much acid buildup in their stomach, owners noticing that they are regurgitating a lot, not necessarily vomiting, but regurgitating, or if they're having trouble kind of getting things going in their GI system, there are these type of antihistamines that we can give them. Also vomiting associated with allergic reaction. So secondary, they get, again, stung by a bee, they have a vaccine reaction, and symptom is profuse vomiting. We can give them something like famotidine, which is Zantac. Famotidine is Pepcid, not Zantac. Famotidine is Pepcid. It comes in tablet form like Pepcid AC over the counter. We also have an injectable form, usually has to be kept in the fridge once it's open. And that was kind of the go-to for a long time for our pre-op patients until they came out with like, Serenia or meropitant citrate. Ranitidine that one's the Zantac. And then cimetidine is just another version. But these are going to be things that we see it a little bit more for maintenance or even just regurg. We can give these kind of medications, not necessarily going to help with nausea, though that has been known to help nausea. But again, kind of like with the antihistamines for allergies, there's better drugs out there for nausea, like your Serenia. And then steroids or your corticosteroids. So natural hormones, adrenal cortex produces them. Most of the corticosteroids we're going to use are synthetic, so it's just kind of a variation on that hormone. There's two groups. We've got our mineral corticoids and then our glucocorticoids. Mineral corticoids are going to help with regulating electrolytes, water balance in the body. Your glucocorticoids are more for inflammation. Also suppressing the immune system if it maybe is going haywire and it's reacting to something that wouldn't normally be, something the immune system would have a problem with. So think your vaccine reactor patients. You give them the December vaccine or the Bordetella vaccine, and their face swells up and they get hives. So that would be a time that we would want to give something to suppress the immune system. Mineralocorticoid, aldosterone would be the most significant one. It's going to help balancing their sodium and potassium. If they don't have enough in their body, they get hypoadrenocorticism, which is Addison's. And that's also the disease process they get if you stop steroids abruptly. That's why we have to taper their dose. If they have Addison's disease, if it's bad enough, it can be to where they get fatal hyperkalemia, hypernatremia. So then the kidneys are not filtering properly. They can't handle things, and then it builds up in the body, in the system. So the drug of choice for aldosterone is Percortin V. It kind of looks a little bit like milk, comes in injectable form, and it's a great medication. It works really well. Owners, you could teach them to give it at home. Otherwise, we could have them come in for tech appointments and give the injection, usually subcutaneously. And then that way they get it maybe once a month, and it keeps their Addison's under control. Corticoids. Think back, negative feedback loop or system in the endocrine system. So cortisol is what is naturally occurring. When it gets too low, hypothalamus kicks on and says, hey, we need to get more of that cortisol. So then pituitary releases more of the ACTH into the bloodstream, which is your adrenocorticotropic hormone. Adrenal cortex gets that ACTH hormone and then releases cortisol at the level that it's supposed to be at. Hypothalamus can't actually detect between naturally occurring what the body's doing versus synthetic. So it is something we can use to our advantage, and we can use that synthetic hormone to help treat some of the problems where their cortisol isn't high enough. Steroids are not the best thing, but they definitely work great. And if it's going to be short-term use, awesome. We can use it to treat either symptoms of a disease, to stop an immune response, to get inflammation down, and that's awesome. And there are times where we have to put a patient on steroids for long-term use, and we kind of just have to have that conversation with the owner. Here's the kind of side effects you're going to see on long-term use of steroids: the polyuria, polydipsia, increased hunger, and it's a conversation down the line that we may have to have on the owner, or the DVM will have to have, that you have to outweigh the side effects of the drug with how well it's working for the system. Pretty much glucocorticoids work on everything, every cell type in the system of animals. They decrease inflammation. They're going to help get the blood vessels maintained, that they have good integrity. They're healthy, stabilizes the cell membranes. We have a decrease in our fibroblast activity, again, with the suppression of the immune system. And it does actually stimulate appetite as well, which can be a good thing if we've got a patient that's not eating. So again, kind of outweighing the side effects of a medication versus quality of life of the patient. So steroids work by blocking or inhibiting phospholipase, and also blocking the arachidonic acid pathway, which you're going to read about. But here's some contraindications, precautions. Again, you guys already know we have to taper our steroids. You can't just abruptly stop them. They can go into an Addisonian crisis. That negative feedback loop is suppressed, and then production of glucocorticoids is ceasing. We don't want to use, excuse me, we don't want to use these as corneal ulcerations because it actually delays the healing process. So there's better eye medications we can use. We also don't want to mix them with our non-steroidal anti-inflammatory drugs. We can see problems, premature parturition, so meaning they go into birth sooner than they should. Abortion in cattle, or spontaneous abortion in not only cattle, horses, and dogs. Adverse effects or warnings that we're, again, in a need to talk to the owner about. We talked about polyuria, polydipsia, polyphagia. So they're hungry all the time, they're urinating, they're thirsty. We'll see some panting, we'll see some weight gain. Muscle wasting. Their coat, their skin isn't as strong as it was previous to taking the medications. We'll start to see an increase in liver enzymes. So we do need to do some blood work when they're on these medications long-term. Extended use can definitely lead to GI ulcers, excuse me, diabetes mellitus. So again, we'll see not only muscle wasting, but they will, like, wound healing will be delayed. Behavioral changes, depression, aggression sometimes. In horses, it's been known to cause laminitis, where they have that inflammation of the corium. This picture, of course, they're showing some weight gain here, dog eating, urinating in the house, excessive thirst. Here are some examples. So of course, prednisone, 5 milligrams up to 20 milligrams. Excuse me, we also have prednisolone. And remember, cats can't, they don't have that enzyme in order to break down the prednisone. So we give dogs prednisone and cats prednisolone. Then we've got dexamethasone injection on here. Dexamethasone, sodium phosphate, or that's called Dex-SP. Those are both injectable. And then there is a suspension, an oral suspension or solution of prednisolone. Excuse me. It's got, I want to say it's like a cherry or a strawberry flavor to it. It's supposed to be kind of sweet, super sticky, but it's great for lower dosing, or maybe animals that can't take the tablet form, or the owner can't give them the tablet form. These are some of the topical sprays, as well as think of your ear medications, so Mometamax, chronic ear infections, or even just acute ear infections. They come in, we clean the ears, and then send home, as well as maybe do like the first dosing of Mometamax to kill off the bacteria and the yeast. So it's got things like gentamicin in it. There is the chlordomazole, just another medication that's going to kill off some of the bacteria or the different strains of it. Hydrocortisone cream helps with itching. Let's talk about the arachidonic acid pathway. So we've got lipoxygenase, sorry. It's an inflammatory mediator. So the leukotrienes, I always mess up these words, they help with the next steps in pretty much like the cycle or the sequence that's associated with some kind of inflammatory response. So white blood cells, or chemotaxis, is attraction of white blood cells to an area where there's inflammation. So when this happens, of course, we see an uptick or an influx of white blood cells, and then white blood cell death releases these free radicals and then protease enzymes. So it's just a matter of inflammation happening in the body. White blood cells are rushing to the area. As the clot forms and everything and the inflammation is happening over time, those white blood cells are going to die. And we can do certain medications to help with the inflammation and kind of getting a decrease in those white blood cells, so they don't feel like they had to be in that area to heal it when we kind of suppress some of the inflammation. So DMSO, or dimethyl sulfoxide, comes in, there's like I don't want to call it a paste. It's a cream. There's also the injectable, but it's got some analgesic effects as well as anti-inflammatory. It does penetrate the skin, so you do need to wear gloves when you are administering. And it does act as a carrier agent, does kind of help with absorption of drugs and toxins. So we have to be kind of careful of how or where you're putting it on the body. Things that wouldn't normally be absorbed topically can be added to this medication in order to get it to absorb pretty much better or at all. So we can add a drug into this DMSO cream and then put that on the area of concern. So here's a good picture. They're showing the dog's wound, and that's definitely something we could put the DMSO on. I feel like most clinics will have this somewhere. They'll have it on the shelf. May not be something they use all the time. Kind of depends on the doctor, their preference, how they want to treat a wound. But used in a well-ventilated area definitely has a strong smell to it, and it does irritate kind of like your nasal lining. Some people don't have a problem with it, but just be careful. Some of the side effects we see: lip smacking, swallowing immediately after topical application, because of the thought that the animal is tasting that drug. So once it gets absorbed, it's the thought that it's made it into the oils and everything, it's gotten into the system, and that they can taste it. Other good medications are our chondro protective agents. And you guys have probably heard of these things like Dasaquin. Technically not a, you don't really need a prescription for things like the Dasaquin Advanced. You could buy it at the vet without a prescription, but most of them are going to require, you have a prescription through like Chewy, through your vet, in order to order it online. But it's mainly just supplementation. So it's going to be like your glucosamine, chondroitin, things that help support the collagen and the joints. They make it for cats and dogs. They usually base it on size. It's like a soft chew. And then we have another drug called Adequan. Excuse me. It was the go-to for a while there. It's an injectable medication. Still works just great, but it reduces prostaglandin release after they've had some kind of injury with a joint. I have seen it used for arthritis in dogs. Excuse me. It's an injection. We can give it subcutaneously. We can also teach the owner how to give it at home. And you start out doing kind of almost like a loading dose. So they get one injection a week for a month. And then after that, we go down to once a month. And then, owner can do this at home if we teach them, or we can set up like a tech appointment and they can come in and just have the injection done. I've seen it work pretty well for arthritis, especially in combinations with things like cold laser therapy or acupuncture. Works pretty good. And then our NSAIDs are non-steroidal anti-inflammatory drugs. Oops. I don't know. This slide doesn't want to move. I guess it is. Okay, there it goes. Sorry about that. Okay. So these particular drugs are NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, work by inhibiting the cyclooxygenase. We've got COX-1 and COX-2 receptors. So you've got your constitutive versus your inducible, and we'll talk about the effects of how the NSAIDs work. So first, actually starting with adverse effects. Long-term use of NSAIDs can cause GI ulceration, bleeding, and actually we can see problems with this. Some individuals, some patients are just more sensitive to NSAIDs than others. So we might only have them on the medication for a day or so, and we'll notice a decrease in appetite or vomiting, diarrhea. And sometimes on this label, we'll tell the owner, if you see a decrease in appetite, vomiting, diarrhea occur, discontinue use and contact your veterinarian immediately. We can also see some nephrotoxicity, suppression of the bone marrow, bleeding tendencies, as well as hepatotoxicity. So it's not great for the liver if we've got maybe a patient that's on NSAIDs, maybe maintenance long-term because they have arthritis or some kind of pain. We can keep them on it. It's not ideal, but we are going to have to do blood work probably every 6 months just to make sure their liver can still handle the NSAIDs. So contraindications, precautions, if they're already in liver or renal failure, we're going to have to be careful with administration of these drugs, and it may not necessarily be the choice of the DVM. They might go for something else, even though it's great to have them on NSAIDs for inflammation. We can try some other things if their liver or their kidneys are already kind of tapped out. If they have a bleeding disorder, something like von Willebrand's disease, clotting problems, we don't want to put them on these. It's going to thin the blood, and we definitely don't want to use it in conjunction with other steroids or other anti-inflammatories. It can cause some gastrointestinal ulcerations. Recommended we monitor the blood work, which I talked about, just every 6 months, checking the liver and kidneys, especially if they're already having problems with those organs. And then decreased liver metabolism, increased potential for toxicity in cats. There's certain ones that we can give, certain NSAIDs that we can give to cats, and certain ones that we could do maybe once for treatment for post-op pain, but there's certain ones that you want to avoid in cats. They just don't handle it as well. Their liver just can't handle it as well as some of the dogs can. So non-specific COX inhibitors, it's things like aspirin. So your acetylsalicylic acid, used for pain relief. It's an anti-inflammatory, antipyrexia, meaning it helps with fever. And then antiplatelet effects. So humans will take aspirin if we need to, maybe they've got like high risk of heart attack or blood flow issues where possibly there's the concern of them getting clots. So we'll have them take aspirin on like a daily basis, like a low dose aspirin. We can use it in animals for same reasoning. We can use it for things like osteoarthritis. If they've got a heartworm infestation, it's going to help, again, kind of decrease some of the blood flow. Cardiomyopathy in cats. And then, of course, bringing down a fever as well as pain. This is not necessarily something that you'll see all the time because we have such good NSAIDs out there now in veterinary medicine. Aspirin's kind of like on the back burner. It doesn't mean it's not still used, but I would say at least the last couple of years I was in practice, I don't know that we ever used aspirin because we had things like tramadol, gabapentin, things for inflammation like your meloxicam. Bute. So your phenylbutazone. It's got a bunch of different trade names, but predominantly used in horses. not approved for dogs. It's it's just not as safe. So margin of safety is not great. We have an injectable form that we can give IV. If you're giving it outside of the vein, so it goes perivascular, it can definitely cause some inflammation and possible necrosis of the tissue. So it's one that you got to be really careful with when you're injecting. So we'll use it for mild to moderate pain in horses due to lameness, helps bring down fevers, and then just anti-inflammatory properties. Phenamine or flunixin meglumine is, again, used in horses. We have found it's approved for cattle. So same thing, they'll use that for some pain as well as just inflammation, bringing down inflammation. So analgesic effects. Musculoskeletal disorders. Does help with visceral pain. So if you've got a horse with colic. Anti-inflammatory properties. And then again, antipyrexia, meaning it's going to reduce fever. So if they've got maybe infection with mastitis, causes a fever because of the bacteria, we can bring it down with this medication. Selective COX-2 inhibitors. So these are things like carprofen or Rimadyl. It's an anti-inflammatory. It's also for analgesic. It doesn't necessarily work as a pain medication, so to speak, but it does help bring down the inflammation so much that then the pain is decreasing. Only approved in dogs. Definitely safer for the gastrointestinal tract than aspirin. We can still see some GI problems though. We do need to monitor for vomiting, diarrhea, melena. So this one is given twice a day. And you can have 25 milligrams, 75 milligrams, depending on size of patient, but this would be given BID or every 12 hours. Comes in tablet, chewable, injectable. Dosage is 1 mg per pound by mouth every 12 hours. So you could definitely give this as an injectable post-op. Comes in tablet form as well, and you can send that home for a couple of days after surgery, or even some arthritis, or if they just had some kind of acute, injury. They, again, jumped off the bed, they hurt their leg, but didn't break anything. It's a good drug for that. Etodolic or etogesic is more selective inhibition of COX-2 than COX-1. Not really safe for dogs under 12 months of age, so more for adult dogs. It can actually cause irreversible dry eye or keratoconjunctivitis sicca in dogs. We'll use it for pain, inflammation, especially when it's osteoarthritis in dogs or older dogs usually that have some just arthritis with age. And I feel like everyone's heard of meloxicam or Metacam. Definitely has fewer side effects than a lot of the other NSAIDs. Still possible though. We still can see vomiting, diarrhea, just GI ulceration. Has been approved for single use in cats. So it's not meant for cats long-term. We can definitely have dogs on, I would say, we'll use it a lot for post-op pain. So you send them home with, so many days, maybe 3 to 5 days of meloxicam. We might even do an injection the day of the surgery, like perioperative or post-op, just to help with inflammation. Meloxicam, a little bit different, works similar to carprofen, but it's only meant for once a day. So you give meloxicam every 24 hours. Not meant to be given twice a day. And then again, you have to be careful. You can't give Rimadyl and meloxicam at the same time. And for the most part, let's say patients on carprofen and they're not handling it well or it's not working, doctor wants to switch them to meloxicam. We're going to have to do kind of a washout period to try and get them the carprofen or the meloxicam out of their system before we start them on that new NSAID. Deramax inhibits COX-2, spares COX-1 at therapeutic doses, meaning if it's something where we're like putting on a maintenance dose, just trying to get rid of the problem, not long-term, not meant for use in cats. Privacox, also similar, treats osteoarthritis, usually flavored chewable tablets you can give them, meant for once a day. There is one for horses called Equiox. So just approved, pretty much, it's Firocoxim meant for horses. Onsior. So your robinecoxib is Onsior. They approved this when I first started in practice, like way back in 2010, 2011, I want to say. They started using it as like the go-to post-op pain for cats. And it would last for, you'd get 3 tablets. So we'd send a cat home after a spay or neuter. We'd send them home with Onsior for 3 days. And it was like a once a day tablet. Worked great. The longer it was out, they did a little bit more research, started using it in dogs. And now I've seen it used in both cat and dog, and not just for post-op pain. I have seen them try and use it for things like just acute pain that's come up for whatever reason, an injury. But it definitely had like a bigger safety margin for using cats to try and bring down inflammation compared to something like meloxicam. And then, of course, your ibuprofen and acetaminophen, so your Tylenol and Advil. Ibuprofen or Advil, not recommended, not approved for dogs and cats. GI ulceration, renal damage, and it doesn't take much. Acetaminophen or Tylenol, it could be used in dogs at proper dosages, but it's not a common use. And of course, never in cats. It's very harsh on their liver. Dogs don't metabolize it as well as we do, as well as humans do. And then cats can't metabolize it at all. Single dose can kill a cat, so we never want to administer acetaminophen for anything. Owners don't understand that necessarily, and they always think, well, if I have a headache, I take Tylenol, I'll give it to my cat. They should be fine. So it's something I've had a lot of phone conversations with owners about. Don't give them Tylenol, just bring them in. It's not an NSAID, not great for inflammation, but it does block that prostaglandin production. So it's definitely used for pain relief and then fever reducer. And then other anti-inflammatories that are not steroids. Big one is your Galliprant. Grapaprant is the brand name. Galliprant's going to be Grapaprant is the generic. Galliprant is the brand. So it's just a non-steroidal. This one was newer, I want to say within the last 10 years or so. Selective prostaglandin antagonist. It's going to reduce the effect of the GI tract, the kidneys, clotting mechanism. Helps control pain and inflammation. Again, osteoarthritis. Always go back to arthritis. Used for dogs 9 months of age or older, and they have to weigh more than 8 pounds. So this one's good. It had a pretty good response. I feel like they have, I'm trying to remember if they have a version for cats now. I think this one was just for the dogs, just because we have such better medications now for cats. So that is another one you're going to see on the shelf. Those are the main ones. Those are the main anti-inflammatories that we use, as well as, not steroidal drugs that we'll use, even just your supplements like glucosamine and chondroitin. Hope that helps. Sorry I couldn't do it in person. I would have preferred that, but of course I was kind of dying at the time with the coughing. I'm better now. I hope you guys have a great break. Good 2 weeks off. I hope you get some rest. Don't work too hard. And then I will see you when you guys get back in 2 weeks. Hope you have a happy holiday too. Bye.